Imagine going through life with constant pain, suffering, and public humiliation. All three can be solved with legalization of euthanasia. Euthanasia is illegal in most countries, however, it is legal in few countries, and other countries continue in serious debates towards legalization. That leads to the question, to what extent does legalization of euthanasia affect and differ with the Netherlands, the United States, and Canada? Good morning. My name is Casey Robertson. These are my colleagues.
My name is Alina Rivera.
My name is Carla Colon.
And my name is Anthony Chung. As stated by our research question, the topic of the legalization of euthanasia has been a fierce topic of debate in the last 21st century. In countries like the United States and Canada, where euthanasia has not been legalized, there's been a fierce topic and controversial ideas on whether or not this practice can have a positive or negative effect on the country state. While in the Netherlands, where euthanasia has been legalized, we can truly get a better understanding by analyzing its both economic and cultural political state. In fact, we believe that euthanasia should be legalized in all first world countries. But to truly understand why this practice can have a positive effect on all states around the world, we must go back to when it first originated.
In the Netherlands, euthanasia was introduced as a topic of debate during the Second World War as part of the practices of the Nazi concentration camp. As shown in this picture, child euthanasia in Nazi Germany was the organized murder of severely mentally and physically handicapped children and young people up to 16 years old in over 30 so-called special children's wards. At least 5,000 children were victims of this program, which was a precursor to the subsequent murder of children in the concentration camp. However, the Netherlands adopted this practice between 2001 and 2002 and have changed to become a positive practice from the perspective of the society. Patients with terminal illnesses now have the opportunity to culminate their life prematurely in order to end their suffering.
But what about the ethical implications that arise with the practice of euthanasia? If euthanasia were legalized in first world countries, this would bring up moral dilemmas regarding the biomedical ethic of personal autonomy. Biomedical ethics are put in place to ensure that the rights of patients are protected. Personal autonomy is an individual's right to self-determination, but also of a physician to create conditions that allow for that self-determination. With euthanasia legalized, this right cannot be protected and this ethic would be breached. In fact, according to the U.S. National Library of Medicine, for every 5 people euthanized, 1 is euthanized without having given explicit consent in the Netherlands. So what is stopping physicians from euthanizing patients without their consent if it is legalized elsewhere? The legalization of euthanasia can bring with it an increase in innocent deaths due to the legalization of euthanasia under the law.
However, Alina, there are strict policies and requirements before a doctor can legally effectuate euthanasia on a patient. These requirements are the following. Only a doctor may carry out euthanasia. There should be a special request from the patient who desires to die. The patient should be in a situation of unbearable pain and suffering with no prospect of change. The doctor should consider the decision and consult with another physician. And finally, the death must be reported to the authorities as a case of euthanasia. Overall, these 5 requirements show that there was a carefully planning into the legalization of this practice.
As Carla and Alina have both gone into the ethical implications of euthanasia, many people in this debate are also bringing up the economic point of view. In fact, according to the World Health Organization's Global Health Expenditure Database, we can see that in 2014, the Netherlands, where euthanasia has been legalized, has spent only 11% of their GDP on healthcare expenditures, while the United States, a country that has not legalized euthanasia, has spent over 17% on that same healthcare cost, showing that euthanasia does have some profound effect on lowering the cost that each country spends on healthcare. In fact, according to Ezekiel Emanuel, an economist who studies the medical costs in the United States of America, states that drugs for euthanasia cost around $30, while treatment for that same disease can cost up to $30,000 or $40,000. Just imagine living your life through that constant pain and suffering that these patients go through, and then being denied the right to end your life prematurely. And then add on to the fact that you are now putting your family in a deep economic rut that you didn't intend to put them in, and that they will experience this kind of debt for the rest of their lives. In fact, according to the Peter G. Peterson's Foundation's article on the budget of the United States government, he states that in 2017, Medicare was 15% of the federal budget, and that this is expected to increase to 21% in 2042. This type of care for elderly patients who may more than willing be ready to die show that there is some dire need to lower the cost of Medicare in the coming years, and that euthanasia, when implemented, can provide that same solution. However, when we start talking about euthanasia and its economic benefits, we bring up the idea of comparing someone's life to a monetary amount. This type of thinking ruins the fragility of life, as well as brings up many ideas economically as well as ethically on why euthanasia should not be legalized. This type of barrier is the main reason why countries like the United States and Canada, who've had fierce debates about this topic, have not legalized it fully nationwide as of yet.
Although many Americans may be uncomfortable with the implications Anthony stated, the tides are slowly turning and few Americans are taking matters in their own hands. This is Dr. Jack Kevorkian, also known as Dr. Death, a physician who practiced assisted suicide illegally and assisted in 130 suicides. Dr. Death was arrested on account of 130 murders, and this led to the recent interest in the practice of euthanasia. In a Gallup poll conducted from 1997 to 1999, 6 out of 10 Americans favored the practice of euthanasia, and this number increased to 69% in a second poll taken in 2016. However, some Americans only agree with the practice of euthanasia under certain circumstances. A city data chart found that most people disagree with the practice if the patient will leave a social economic burden on the family, but the majority of Americans will agree with the practice if the patient is in a great deal of pain with no hope of improvement or has an incurable disease. We believe that euthanasia should be legal, but only under certain conditions.
There is a similar culture climate in Canada, where people are pushing for the legalization of euthanasia, but only under strict circumstances. A study was conducted by the CMA asking physicians whether they believe euthanasia should be legal under the law. And as you can see from the results, although most opinions are half and half, the majority of physicians believe that it should be legal to request active euthanasia. In countries considering the legalization, like Canada, and countries that have already legalized euthanasia, like the Netherlands, there's a running theme in which they are considering the rights of the patient to choose their own fate. As Carla brought up in the case of the Netherlands, when a country considers legalizing euthanasia, they must go over public policy and set strict requirements before anything is done in public policy. Canada is also taking steps like this as well, as you can see from this publication by the CMA of Public Policy, where the well-being of a patient and provide appropriate care for them must be protected before anything is done to legalize euthanasia, even if this means medical aid in dying.
The practice of euthanasia is illegal under sections 14 and 241 of the Criminal Code. Through these code sections, the law establishes that no patient can say to their doctor, "Kill me," because of section 14, and no doctor can say to their patient, "You need to die," because of section 241. However, according to the 2005 Angus Rate Survey of 1,122 participants from across Canada, was found that 45% of the people voted in support of the legalization of euthanasia, while only 39% opposed the legalization of euthanasia and 16% was undecided. Based on these results, those code sections should be overturned and the legalization of euthanasia should be reconsidered in Canada.
As shown in each of these images, the topic of euthanasia in this day and age has become a huge topic of debate and is constantly conflicted throughout many countries throughout the world. However, in fact, we believe that euthanasia should be legalized in these countries for a variety of reasons, and that there should be strict restrictions, as the Netherlands have implemented, on euthanasia as well. These restrictions include the explicit consent of the patient, as well as the declining, despairing aspect of the patient's health. However, this doesn't address all the issues in this debate. Some of these issues include comparing someone's life to a monetary amount. However, that kind of issue will be forever lasting in this debate. And the public support, as shown by Casey and Carla's graphs, show that euthanasia can make many positive strides, economically,
Politically,
Ethically,
And culturally.
Thank you.
All right, guys, let me ask you some questions. Okay, let me ask you some questions again. We'll start over here and work our way across. And Lena, can you describe how the content of your team presentation was changed as a result of group discussions?
in the beginning, we had all decided on showing a video on the process or showing the effects of euthanasia, but as we discussed Anthony's perspective and Carla's perspective, we figured that it wouldn't really work, and based on time, we decided to cut it.
What is the way in which your team's resolution makes you think differently about your own individual research?
Originally in my research, I found a lot of information that was against euthanasia, but based off of Casey's information and Alina's information, we came to the conclusion that a solution involving the implementation of euthanasia would be positive, and as my lens was economic, it showed that the ethical implications of actually the economic lens was the one that was preventing me from reaching the same conclusion they did. But with their information, we were able to come together as a team to legalize euthanasia.
Okay. Carla, in the future, what change would you make to your group norms, and how would you expect that to improve your team presentation?
In the future, I will develop more strict norms about the due dates we set up for ourselves in the paper draft, and also like more norms in the meetings and communication skills, so we can be able to like develop a better presentation and have more time to prepare.
Okay. Casey, can you describe an argument from one of your peers' individual reports that made you think differently about your team's solution?
Originally, in Anthony's individual report, he discussed the economic effects of euthanasia, and in my individual report, I had more of a factual evidence that was for euthanasia, but Anthony had economic evidence that was against euthanasia, so it kind of changed my opinion and it helped me out later in my presentation.
All right, thank you.